name is Leslie Love. I am an art therapist in Richmond, Virginia at a residential group home. I have been an art therapist for about 4 years. I came into the field of art therapy when I was doing undergraduate work in art education, and I was a student teacher, and I was seeing 1,000 kids a week and doing artwork with them, and realizing that most of the classes were about an hour, but then you had to get kids in, you had to get them explained to them the information, do a lot of behavior management, and so the children really didn't get a chance to do more than probably 15 or 20 minutes of artwork, or probably close to 15 minutes of artwork. And it just wasn't enough for me. And seeing 1,000 kids, I just didn't get a chance to really get that personal interaction with them. So I ran across a book about art therapy being done with kids who were in domestic violence shelter homes, and the impact that it had for them, and which really inspired me, and was really what I'd always been interested in psychology as well, so that kind of showed me kind of a marrying between what I loved. So I researched and found a graduate program that had an art therapy program, and went there, and then graduated and worked in a psychiatric hospital after graduation. As far as what I would suggest or give advice to for people who are coming into the field, I would definitely say that you need to have a passion for art as well as helping people. You really need a lot of flexibility, because I found that whenever I try to go do something with the kids, sometimes they're not there, or I have these wonderful, great ideas, and then I get there and the children are just really not in a space that what I want to do is important to them. They're in a space where they need to be doing something else, so I have to be flexible enough to meet their needs as opposed to my needs. And so flexibility is a very big key, and I would definitely say a good drive and support system are also important to have within this field. As far as what I would like to see for the next 5 years, I would definitely like to see a lot more cohesion within our own profession and within our own organizations. I think that sometimes we lose track of the bigger picture and focus on some of the smaller things that are important but not vastly important. And I would also like to see us move towards the minimum licensure protection, title protection. I think that right now there are a lot of people who are practicing and saying that they're art therapists but don't have the background or the training or the understanding of art therapy to actually implement it correctly and in a healthy manner. So I would like to definitely see at least title protection. I would really like to see licensure. Some of the states have gotten licensure, which is great. However, most of the states do not have licensure, and it would be nice that we could all become states with licensure, because I think that would also help us become more of a respected field as opposed to being seen as just a technique and something that anybody can do. I think so. I'd really like to see all of that change and become more of a reality. I doubt it will be in 5 years, but at least the steps towards that occurring. The best thing about being an art therapist, I think, is the ability to offer your clients and or yourself an alternative to a way of expressing yourself and an alternative to just the verbal. I think a lot of people are so verbal that they lose track, or you sometimes just can't come up with the words, and you get more frustrated trying to express yourself than if you just didn't at all. And art therapy and just art in general is a method that you can use to show people as well as explain it to them verbally. So So I would really, that's one of the things. And also I like being able to show people and have a different way of thinking, a different way of doing things, so people aren't stuck in their rut or stuck in a box, and art allows them to think outside of the box, be more creative, and exercise the other side of their brain so that they're not just all left brain.